Good morning. My name is John Fechter, and I'm a first-year pharmacy student at the University of Charleston School of Pharmacy. Today, my classmate George Kalino and I will separately each be presenting a video addressing the patient care issue of excessive intestinal gas. In my video, I will be the pharmacist, and Dawn Kennedy will be playing the part of Jolene Watts, a 26-year-old female that is coming to the pharmacy for assistance for her intestinal gas. The over-the-counter medication we will be discussing is Simethicone. Good morning. Thank you for visiting Prescription Plus Pharmacy. My name is John Fechter. I am the pharmacist on duty. How may I help you today?
Well, I've been experiencing some excessive gas and like bloated feeling, and I was trying to look for something that would help with that.
Okay. Would you mind taking a seat? I'm more than glad to give you some time. Okay. That might be more comfortable than standing up for a few minutes.
Yes.
So do you mind if I ask you a few questions to better understand your symptoms and to see if any of the over-the-counter medications I can think of might help alleviate them? It should take maybe 5 minutes of your time. And if I'm able to come up with a medication that would be suitable for treatment, it should take maybe a few more minutes just to get you acquainted with the safe and effective use of it.
Yeah. Oh, I got to.
Okay, great. Can I start with your name and your date of birth?
Oh, Jolene Watts, 3/7/94.
Oh, great, Miss Watts. So let's get started. You've mentioned you have some excessive gas.
Mm-hmm.
Would you mind describing the symptoms that you have?
Just like a bloated, full feeling. It's more discomfort than any type of pain, but just like a really bloated feeling.
Okay. In terms of severity, how would you rate that on a scale of 1 to 10?
No, it was not quite that bad. Maybe during the worst time, about 4.
Okay. Good to hear. It could definitely be a lot worse. I'm glad it isn't. And have you experienced something like this in the past? And if you have, what would you be able to tell me about that?
I've noticed like during the holidays and stuff where you got like the family get-togethers and during summertime, big family picnic get-togethers and stuff like that. And there's being a lot of food and stuff. You don't really pay much attention to how much you eat. I've noticed like after that, then I'll be all kind of like bloated, full feeling, and then of course, you know, if you're hanging out with friends and stuff like that, you're not exactly paying attention to what you really eat. So.
Oh, I definitely understand how that could end up being an issue. I can definitely relate. You know, I've definitely had times like that. We probably all have. In terms of where you feel discomfort, would you care to explain where it is most uncomfortable?
Well, the bloatedness, the full feeling, it's like all across in here, but as far as like where the actual, I wouldn't necessarily say pain, but the most discomfort is kind of along the lower area.
Okay. And what would you say makes your symptoms worse?
If I'm sitting still or if I'm lying down, that's when I notice it's most uncomfortable.
Okay. And what would you say helps alleviate your symptoms and make you feel a little bit better?
Well, if I'm moving around, really.
Okay, great. Activity, it sounds like activity helps the moving around. That's definitely a great sign. Are you on any medications right now, either prescription or over-the-counter?
Doctor has me on 750 milligrams of metformin. I'm also chewing nicotine gum to do the official quit smoking, and those little over-the-counter they're like the little gummies that's specifically for the hair and nails. So that's basically what I've been taking.
Okay, yeah, they those gummies have biotin in them, so I'm definitely familiar with that. And I've made a note of that for part of my analysis. And do you have any allergies that I should be aware of?
Not that I'm aware of. I haven't come across like any medication or anything like that, or anything that I have had an allergic reaction to.
Okay, that's definitely a good sign. And do you have any health conditions at the moment? I know you mentioned taking metformin.
Type 2 diabetes.
Okay, that makes sense. That is a common medication with type 2 diabetes. And how often would you say you have an alcoholic beverage, or how often do you smoke?
I was smoking approximately half a pack of cigarettes a day, and I noted that when I would be drinking, that I would end up smoking more. And also, my doctors told me that when you drink alcohol, that will raise up your blood sugar. So diabetes, I have to take that into account. So I limit my drinking, maybe one alcoholic drink a week or something like that, if that.
Okay, that's pretty good. So I encourage you definitely to continue your nicotine replacement use. It seems to be working, especially with you being concerned about not drinking excessive alcohol that would increase your smoking. I have a few more questions to determine if I can recommend a medication for you today. Have you noticed any unexplained weight loss?
Not unexplained. I'm trying out the keto diet, basically lowering the carbs, eating more vegetables, broccoli, cauliflower, greens, that type of thing.
Okay. And do you have any sudden or severe pain in your abdomen with this recent experience of intestinal gas?
No.
Okay. And have you noticed any bleeding, diarrhea, or constipation?
No.
Okay. You said you've been taking walks, which helps reduce your symptoms, so I encourage you to keep doing that. Typically, I'd recommend a few non-pharmacologic treatments aimed at reducing excessive gas, such as not chewing gum with your mouth open and eating cruciferous vegetables like broccoli, cauliflower, which are commonly things that are part of a keto diet.
Okay.
And have you ever tried diet changes before to help with this?
Yes, but I've noticed that it didn't really matter much as far as like to change the diet. Just yeah.
Okay, so I see that based on what you've said, there's a few things that could be contributing, such as chewing the nicotine gum and using metformin. I recommend chewing the gum with your mouth closed to help minimize the amount of air that you swallow, because the more air that you swallow, the higher amount of gas that you can have. And also, I would recommend getting an exercise ball and using that instead of your chair at the work site in the office. It will enhance your posture, and it could help minimize the symptoms of the excessive gas. It may also be beneficial to keep a diary and know what time you take your metformin, what you eat, and when the gas starts.
Okay.
All right. Alongside these changes, I feel comfortable recommending a medication to you.
Okay.
All right, Ms. Watts, this is the medication, or rather, the medication I'll be recommending is Simethicone. It's the active ingredient in Gas-X, which is the brand name product that I'll show you to after we're done talking. It is used to reduce intestinal gas. It works by reducing the surface tension of gas bubbles in your intestines, meaning that it makes it easier for your intestines to break it up, thus leading to less excessive gas. It does not have any noticeable side effects. The only precaution is to not exceed 500 milligrams or 4 capsules a day. It's available in 125 milligram capsules, and it may decrease the effectiveness of levothyroxine, but considering that you're not on thyroid replacement or levothyroxine prescription, it will not have any relevance to you in that area. But it is important to let your doctor know that you're on this medication, so they may keep it on record for the future. And if you miss a dose, don't worry. If you haven't felt like taking it, it just means that you didn't need it, because it's on an as-needed basis. Also, you shouldn't take it close to any other medication, such as your metformin. I'd say with your metformin, taking that, wait at least 30 minutes before you take the Simethicone, or the Gas-X, which is the brand name. It should be stored at room temperature in a dry place away from light. And within 48 hours, I'm going to follow up with you, give you a phone call to see how it's working.
Okay, thanks.
All right, wonderful. Do you mind repeating back to me the key points to ensure you can effectively and safely use this medication?
Okay, you're saying that I take 1 capsule after I eat and 1 capsule at bedtime. That if I miss a dose, that just means that I didn't need it at that point in time. It's an as-needed basis. If I take my metformin or any other medication, I should wait about 30 minutes after before I go and take one of those. Not to have it just sitting on the windowsill with the sun shining down on it. Best place would probably be my medicine cabinet.
That's great. You definitely seem to, have a good grasp. It's very simple, and I'm glad that, it sounds like you feel comfortable with the information I've given you. So I would say, first, thank you for your time. I appreciate this. Sometimes when we're all in a rush, we'll just want to get out of there and not really be paying attention. I hope your symptoms are relieved by this, and keep an eye out for a follow-up call from me sometime within the next 2 days.
Okay.
And again, thank you for coming in today.
Appreciate it. Thank you.
You're welcome.